I just wanted to share with you some thoughts on the profession, on the medical profession. The coronavirus epidemic had deep changes both in our society and also in our profession. Initially, while the threat was unseen and unknown, a lot of people were very excited and very anxious on how medical systems will cope with it, and physicians, being at the very forefront of medical systems, were very much in the spotlight. In our country, a lot of people were clapping every evening at 9 o'clock. Praising physicians was as a daily routine on many of the public media and also on social media too. The profession came to a high social standing, and many of the people working in medicine became used to being in the spotlight. Now, as the pandemic progressed, a lot of the medical uncertainties started being reduced. We know more about the virus. We know more about how to cope with the problem. And as the pandemic wanes, the attention is shifted towards the purely economic consequences. And now another professional group, the economists and the social scientists, are coming to the forefront. And this is leading to a reduction in the attention physicians are getting on this topic. And a lot of physicians are feeling kind of left out or excluded from the public discourse. And a lot of them even are thinking that this is being unfair because patients are shifting their attention towards more pressing matters. So while attention was high, people were quite positively inclined to the profession. Now, when the attention is waning, people are starting to become frustrated, especially medical professionals are starting to become frustrated how quickly and how fickle the public attention is. Many of especially of the older physicians, know that they've lived in a time when the medical profession was an important one. And they're used to being regarded as somehow a social elite. In the last couple of years, or maybe even the last decade, the profession of a physician became much more a service profession, not so much a cause or a dedicated profession with a big P, but rather a profession which is much like many of the other service professions, just a profession serving social interests. And it's a very difficult transition to make when in the university they're telling you that you have the Hippocratic Oath and society owes you a lot because you're doing so much about life. And then when you come out in society, you find that a lot of people are actually just thinking of you as an auto mechanic for people, or a people, or other professions who are purely service professionals, like, for example, a waiter in a restaurant. So it's a very big and very hard lesson to learn. I hope that in the future medical universities will pay a lot more attention to this topic, because it's an important one, and you shouldn't structure expectations in the future medical professionals, because when they come out in reality their expectations are not met, and it's a big letdown. And it shouldn't be like that. It is a profession which requires a lot of dedication, a lot of skill, a lot of knowledge, and people shouldn't be feeling let down. So that was the topic I just wanted to touch upon. There's lots of things which can be talked around this topic, but I hope this kind of raises the edge of the curtain on this.